Then we'll see about DLBCL, which is diffuse large B cell lymphoma. So as the name suggests, it is going to be diffuse sheets, large B cell in the sense the cells are going to be quite large. So under the lymphoma categories, if you see small cells, medium cells and large cells, diffuse large B cells come under the large cell category. And here it usually involves the elderly age group, so more than 60 years, and here the prognosis is going to be quite bad because these tumors are quite aggressive. Immunophenotype, again, if you see, this is from the germinal center mainly. So CD10 is going to be positive, BCL6 is going to be positive. Apart from that, CD19, CD20 and PAX5 are again going to be positive. Okay. So when the follicular lymphoma is going to be transformed into DLBCL, you can have a translocation 14-18 associated with this. Then you can also have some involvement of the BCL6. So BCL6 rearrangements can be seen, or mic translocations can also be seen. So whenever there is mic translocations, it is going to be bad again. Okay, mic, wherever you see mic is going to be bad. So mic was a proto-oncogene, which is a nuclear regulatory protein, right? So mic is going to be bad. So this DLBCL can also be associated with EBV, HHV8, which is herpes virus, and also with HIV. So in if you saw in HIV, we saw the most common lymphoma was NHL, which is primary CNS lymphoma, and that had a DLBCL kind of a morphology, right? So any immunocompromised state, that can also lead to this DLBCL. So HHV8 was associated with Kaposi sarcoma as well, right? So HHV8 is again associated with immunocompromised kind of a status. Then moving on to the next lymphoma, which is Burkitt's lymphoma. So Burkitt's again is going to arise from the germinal centers. So mature B cells is it is going to arise from the mature B cells, and as such, Burkitt's lymphoma is a very aggressive kind of a lymphoma. But here, if you see, there is going to be high turnover of the cells. So lots of proliferation will be there. So if you see the lymph node morphology, there is going to be lots of mitotic figures. It is a highly proliferative kind of a lymphoma, and it is associated with tumor lysis syndrome. So there is going to be hyperuricemia associated. So high turnover of this lymphoma is there. So hyperuricemia will be there in this case, associated with tumor lysis syndrome. So high proliferation rate, in the sense, if you put a Ki-67 proliferation index, it is going to be 100%. So this is kind of classical again. So 100% positivity. So entire cells are going to be positive for Ki-67. That is the kind of image you see in Burkitt's lymphoma. So coming to the genetics here, so this again is going to have multiple translocations. So translocation 814, translocation 28, translocation 822. So all of this is having this translocation 8 involvement, right? So 8th chromosome is the location of mic, C mic. Okay, so C mic is going to be located in the chromosome 8. So whatever translocation, it is going to cause the C mic upregulation. So whenever C mic is upregulated, it is an oncogene. It is going to cause cell cycle proliferation. Okay, so here the immunophenotype is going to be CD19 positivity, CD20 positivity being a B cell lymphoma, and then CD10 and BCL6 is positive because it is from the germinal center, and then surface immunoglobulins. Surface immunoglobulins will be positive in any of the mature B cell lymphomas. Okay, so all of this is going to be positive in a Burkitt's lymphoma. So you must remember, Ki-67 index was 100%. Apart from that, it is a very aggressive kind of tumor, and the genetics is important here. So microscopically, if you see, we have a classical image here. It is going to be given the name starry sky appearance. So starry sky appearance, because if you see, this is the histological image of the lymphoma here. So it is going to be seen in diffuse sheets. So in diffuse sheets of these atypical lymphoma cells are going to be there. Apart from that, these bigger cells in between you are seeing, right? So these cells are nothing but macrophages. So these are tingible body macrophages, which are actually taking up the broken material. Like the lymphoma cells are continuously dividing, right? So the broken material is going to be taken up by the debris, is going to be taken up by this tingible body macrophages. So they appear as if they are going to, they are stars. So these tingible body macrophages are the stars, and the background is the sky is going to be formed by the lymphoma cells. So it is called as the starry sky appearance, again classical for a Burkitt's lymphoma. And where else in pathology did we see the starry sky appearance? This starry sky appearance is also seen in kidney disease, which is a nephritic condition, post streptococcal glomerulonephritis. So there you are going to have granular immunofluorescence. So that granular immunofluorescence pattern in the PSGN is going to be called as the starry sky appearance again. So in this Burkitt lymphoma, if you aspirate the bone marrow, again, it is going to have a classical morphology. So in this, they are going to have cells with royal blue cytoplasm. So quite dark blue kind of a cytoplasm with lipid vacuoles. Multiple lipid vacuoles are going to be present and a prominent nucleoli. So this is the classical image of a bone marrow aspirate in a Burkitt lymphoma. So if you see, look at the cell. Quite beautiful, right? So this is having a very dark blue kind of a cytoplasm. So the cytoplasm here is very dark royal blue kind of cytoplasm, and there is going to be multiple lipid vacuoles in this. So and previously in ALL, I mentioned L3, right? So Fab classification L3. So L3 also has similar kind of cells with this multiple lipid vacuoles. So that kind of a morphology is seen in Burkitt's lymphoma. So this royal blue cytoplasm with this lipid vacuoles. Apart from that, there is also going to be presence of prominent nucleoli in these cells. So these are again the image-based questions related to Burkitt's lymphoma. So we have three basic subtypes under Burkitt's lymphoma. So we have African or the endemic subtype, then the sporadic subtype, and the HIV associated or the immunocompromised subtype. So the African or the endemic subtype is going to be associated with EBV 100%. All three are going to be associated with EBV here, but 100% association is seen with African or endemic subtype, and here it is usually children, African origin children, and they'll have mandible. This lymphoma is going to arise in the mandibular location. So they are going to have a cheek mass. So they are African child with the cheek mass, then they are hinting towards a Burkitt lymphoma. Remember that. Then in sporadic Burkitt lymphoma, just like that it is arising. So in this case, the EBV association is going to be 20%. Here it could be either a child or a young adult. And the classical history given here will be a abdominal mass. So abdominal mass in the ileocecal region. So ileocecal region, if they give, so abdominal mass, sporadic BL. While if it is a mandibular mass in a child of African origin, it is going to be an endemic or a African BL. While HIV associated is going to be quite aggressive and with worse prognosis. And here the EBV association is going to be 25%. Okay. So EBV associated lymphomas, we have this Burkitt lymphoma. Apart from that, we have Hodgkin's lymphoma, and then nasopharyngeal carcinoma, which is going to be seen in the Southeast Asian countries usually. Okay. Then the EBV is also associated with post-transplant lymphomas. So next move on to the next NHL, which is hairy cell leukemia. So hairy cell leukemia, as the name suggests, the cells are going to have hairy projections. So this is the cell, they are going to have some kind of hairy projections. So this is why it is given this name hairy cell. And since it's a leukemia, it is going to involve the peripheral blood. So the classical history given for a hairy cell leukemia will be an elderly male coming with a massive hepatosplenomegaly. So massive hepatosplenomegaly, and in the blood, if you see, they are going to have pancytopenia. So this leukemia, I told, right, so they can involve the bone marrow and the peripheral blood as well. So in the bone marrow, if when this hairy cell leukemia is infiltrated, it is going to cause bone marrow fibrosis. So whenever there is bone marrow fibrosis, it is going to yield a dry tap on bone marrow aspirate, right? So when this bone marrow is going to be infiltrated by the lymphoma cells and also by this fibrosis, there is no space for the other hematopoietic cells, stem cells. So the hematopoiesis of other cells are going to be depleted, and that is going to result in the pancytopenic picture in the peripheral blood. So pancytopenia with massive hepatosplenomegaly, you have to think about hairy cell leukemia. And here it is going to be associated with atypical mycobacterial infections as well. Having pancytopenia, obviously multiple infections will be prone in this case. So genetics of this will be BRAF mutation. So hairy cell leukemia, you are going to have BRAF mutations at least 60%, sorry 100%. So more than 90%, that is nearly 100% actually, hairy cell leukemia is going to be associated with BRAF mutation for up to 100% as well. And then in the bone marrow biopsy, again, they are going to have a classical appearance. So the cells of this lymphoma are going to have a fried egg appearance, as if there is a halo around this lymphoma cells. So fried egg appearance giving a honeycomb kind of a pattern. Okay, so this again is the classical finding in a hairy cell leukemia. So where else did we see fried egg appearance in pathology? So fried egg kind of cells can also be seen in the oligodendroglial cells. So in it is a glioma, oligodendroglioma. There again, the cells are going to have a fried egg kind of an appearance because of a perinuclear halo. So in bone marrow aspirate, I told it is going to yield a dry tap because of bone marrow fibrosis. So coming to the immunophenotype, so nothing specific here. So immunophenotype is going to be CD19 positive, CD20 positive initially. So these are B cell markers. Apart from that, CD11C is going to be positive, CD25 is going to be positive, and CD103 is going to be positive. Annexin A1 positive. Annexin A1 is in fact, the best and the most specific marker also. Okay, so this is quite important here. So CD19 and 20 positive because it's a B cell lymphoma. Apart from that, CD11C positive, CD25, CD103 and annexin A1 positive, which is the best and the specific marker. Okay, so you'll have to remember this. If you remember CD25, where else did I mention? CD25 was expressed by the T regulatory cells. So T regulatory cells were positive for CD4, FOXP3 and then CD25, right? So hairy cell leukemia and Treg cells are going to be CD25 positive. Then the special stains, again the special stains are important here. So hairy cell leukemia is the only lymphoma which is going to be positive for TRAP. So TRAP is nothing but tartrate resistance acid phosphatase. So TRAP positivity is going to be seen in hairy cell leukemia. So if you remember in ALL, I was mentioning TALL, which is going to be positive for acid phosphatase, giving a specific polar kind of a staining, right? In a corner alone, there was a dot-like positivity. So polar positivity for acid phosphatase was there in ALL, but there I mentioned it is going to be tartrate sensitive. So the only thing which is going to be tartrate resistant is going to be a hairy cell leukemia. So in the peripheral smear, if you see, it is going to have this kind of large atypical lymphoma cells, and at the periphery of these cells, if you see, it is not quite proper, right? It is having something at the periphery like this, like hairy projections are there. So that is why this name of hairy cell leukemia has been given. So one other important thing about hairy cell leukemia is, I told it is going to have, they are going to have hepatosplenomegaly. So in the spleen as well, there is going to be involvement by this lymphoma. And in the spleen, where? So in the spleen, it is going to involve the red pulp here. Okay, so usually B cell lymphomas, where is the location of B cell lymphomas in the spleen? It is going to be in the follicles, right? So white pulp, but the red pulp is actually the sinuses. But there are very few lymphomas which have the red pulp involvement, and that is one of the examples is hairy cell leukemia, and the other example is going to be hepatosplenic lymphoma. Okay, so both are starting with H. Hairy cell leukemia and hepatosplenic lymphoma are the ones which have a red pulp involvement. So there are many specific things in hairy cell leukemia. Firstly, an elderly male group, elderly male presenting with a massive hepatosplenomegaly in a pancytopenic picture involving the red pulp of the spleen here. And then the immunophenotype was quite specific, CD11C, 25, 103 positivity, along with annexin A1 and then TRAP positivity. So all of this is quite specific for hairy cell leukemia. So in the peripheral blood, we saw hairy cells, bone marrow aspirate, dry tap, bone marrow biopsy, fried egg appearance. Okay.